Today's medical-centric topic is acromioclavicular joint separation, symptoms, diagnosis, and treatment. Acromioclavicular joint separation, also known as shoulder separation, is a common injury that can cause pain and limited mobility in the shoulder. It's important to understand what causes this type of injury, the symptoms associated with it, and the various treatment options available. In this video, we'll explore all of these topics in detail. 1. What is acromioclavicular joint separation? Acromioclavicular joint separation occurs when the ligaments that attach the collarbone, clavicle, to the shoulder blade, scapula, are damaged or torn. This can cause a separation of acromioclavicular joint, which is the joint where the collarbone and shoulder blade meet. 2. Causes of acromioclavicular joint separation. Acromioclavicular joint separation is typically caused by a traumatic injury to the shoulder, such as a fall or direct blow to the area. Athletes who participate in sports such as football, hockey, and skiing are at higher risk for this type of injury. 3. Symptoms of acromioclavicular joint separation. The symptoms of acromioclavicular joint separation can vary depending on the severity of the injury. Mild cases may only result in slight pain and swelling in the shoulder, while more severe cases can lead to visible deformity, significant pain, and limited mobility. Other symptoms may include a popping or snapping sound at the time of injury, tenderness or bruising in the shoulder area, pain when moving the shoulder or raising the arm. 4. Diagnosis of acromioclavicular joint separation. If you suspect you may have acromioclavicular joint separation, it's important to seek medical attention. A doctor or healthcare professional can diagnose this injury through a physical examination and imaging tests such as X-rays or MRIs. They will typically assess the level of severity and determine the appropriate course of treatment. 5. Treatment options for acromioclavicular joint separation. Treatment options for acromioclavicular joint separation may vary depending on the severity of the injury. Mild cases may only require rest, ice, and over-the-counter pain medication, while more severe cases may require surgery to repair the damaged ligaments. Physical therapy may also be recommended to help restore range of motion and strength to the shoulder. Some of the treatment options include rest and immobilization. Resting the affected shoulder and wearing a sling or brace may be recommended to prevent further damage. Pain relief. Over-the-counter pain medications such as ibuprofen or acetaminophen may be recommended to relieve pain and reduce inflammation. Surgery. Surgery may be necessary for more severe cases of acromioclavicular joint separation. The surgeon may repair the damaged ligaments using screws, plates, or other hardware. Physical therapy. Physical therapy may be recommended after a period of rest or surgery to help restore range of motion and strength to the shoulder. Acromioclavicular joint separation is a common injury that can cause pain and limited mobility in the shoulder. It's important to seek medical attention if you suspect you may have this type of injury. With the appropriate treatment, most people are able to recover fully from acromioclavicular joint separation and return to their normal activities.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.